Hello everyone, my name is Audrey Lee and I'm an undergraduate at Columbia University pursuing biomedical engineering. Today I am here with Every Woman, Every Child to present to you technologies and their innovations targeting healthcare and well-being. So I have Sid Goyo from Livi. I also have Dr. Marianne Etiebet from Merck for Mothers. I also have Dr. Mark Mitchell from D-Tree International. So I would like to ask our panelists today to elaborate on their roles within your innovations, as well as what do your innovations actually do?
Sure. I'm Mark Mitchell. I started D-Tree International about 14 years ago in order to improve access and quality of care for women and children in poor countries. We do that by putting a cell phone, today a smartphone, in the hands of health workers that they use as they're seeing clients to make sure they follow the correct advice, treatment, and do provide the best possible care to those that they see.
Great. So I'm from Merck for Mothers, and we exist to create a world where no woman has to die giving life. And we want to bring the private sector approach to that. And so it's apt that we're talking about this in the innovation marketplace, because we believe that it's the disruption, the invention, the innovation, the thinking about bringing to scale for all of these innovations that's going to make the difference for mothers.
And I am CEO of Livi, and we created Livi with the simple idea of improving information about and access to family planning services. So what we have is a simple phone-based screening system where any woman or child or family can call in, go through a couple-minute screening session, and from that what they get is a set of recommended methods that are appropriate based on their preferences and history, and then referrals to local clinics. And then they have the opportunity to rate their experience at the provider. So creating this sort of circle, end-to-end solution for individuals to access health services in a more efficient manner.
So Sid, I have a quick question about Livi. Yeah. So in the development of your application, what inspired you to develop this?
Sure. So I've been in the technology realm my entire career, and actually the inspiration came from my co-founders, Ben Bellows, who's at the Population Council, and Eric Green, who's at Duke University. Ben and I were just talking one day at Java House in Nairobi, and he said, I want to build this digital marketplace for family planning services. I don't know how to do it. And from there, he also indicated, oh, well, Merck for Mothers is sort of interested in this. I said, well, okay, let's chat. And over there, we developed through the course of 8-9 months, we developed the concept. Merck for Mothers actually funded the initial project through the Population Council, and then we just closed an investment at the end of May from Merck to really scale out the tech and build this consumer-facing health service. I've been in the consumer market for pretty much my entire career, and that was my inspiration for doing this, and I've always been interested in health access in emerging markets.
So Marianne, could you please speak about your involvement, or like how Merck with Merck for Mothers has been involved with Livi, and what is the story behind it?
So as Sid mentioned, some of these things happen just serendipitously, and we are always on the lookout for good ideas wherever they are. And I think, the story he described about working through partners and collaboration to find a good idea and to think about working together to actually develop that idea. And one thing he didn't mention, it's not just what the expertise Merck can bring, to a small startup. But that whole process of design, we involved the actual consumers and clients at the end. They were an integral part of it. And the point about sustainability is key, because when we think from a private sector approach, at the end of the day, these innovations have to be sustainable. People have to want to use them.
Yep.
And so moving from a grantee type, grant funder type relationship to thinking about how Livi could become a social enterprise and actually attract funding, because there are many people out there in the world that are interested in impact investing. So investing in technologies that are going to make a difference for the world, and for us all here today at UNGA, actually drive towards the SDG goals.
So Dr. Mitchell, in regards to D-Tree International, so I understand that it began in 2004, so I believe with more mobile applications, it wasn't as widespread back then. But I'm curious to see how technology has changed the advancement of your programs.
Mm-hmm. So when we began, technology really wasn't being used very much. Mm-hmm. And the dilemma we were trying to confront was, how do you get health workers to do what they were once trained to do, but maybe don't continue to do because they don't get enough supervision and support? And it seemed clear that using clinical standards, protocols, and putting them on an electronic format in their hand was a good way to bring them closer to what it was they were meant to be doing. And so we began using feature phones, and we actually began on Palm Pilots, but then moved to feature phones, and then now use smartphones. And the evolution of technology has enabled us to do much more complex things, to add Uber for mothers so that women actually get access to health facilities, to add mobile banking, to add many other pieces, so that as the technology has evolved, our use of the technology has evolved to deliver a more finished product for each client.
Okay. So what are there specific impacts that you can speak about that D-Tree International has with its programs?
Sure. So one of our programs in Zanzibar, a lovely island, which is part of Kansas.
We all
very
want to
nice
come
island,
and see what you're doing on the ground.
Yeah, absolutely, which is part of Tanzania, where 60% of women were delivering at home, and a home-based delivery is not safe. And so we committed to figuring out how to have safer deliveries. And our program over the last 3 years has gotten that number of women who deliver in facilities from 40% to 78% after 20,000 deliveries. Community health workers using phones in their hands develop birth plans. That's where one of the places we're using Uber for mothers, where we line up people with private vehicles, pay for it with mobile banking. The mothers are taught how to save money into a mobile bank account, and that's what's achieved those results. Yeah.
So Sid, in regards to Livi, what are the types of impact that you've seen your company do?
Yeah, I mean, I think there's a couple things. There's numbers, and we can, about 9,000 users have used Livi over the course of the past year, working in a small catchment area in Bungoma County. It's not Zanzibar, I can tell you that. But it's a beautiful place, and all these people want is good information. And what we found, just through individual stories actually, is the fact that people say, oh, I didn't know I could use this method based on where I am in my life. I didn't know I could access this facility. I didn't know this facility was close by. So it's all about that idea of information access, and so we hear that through these individual stories. We see that in the data. We saw, to get technical, we had a master's student who's now one of our product managers, Alex Whitcomb. She came in and she did an analysis on Livi users and found that over 50% of Livi users were opting for longer term methods. And that's generally not the case. In Kenya especially, injectables are quite popular, and worldwide too. But here we had over 50% of our users using implants. And so, you see just that idea of information access is such a big game changer. It's kind of like the Ubers of the world. That Uber for delivery is like a really good example, is like just being able to get from point A to point B, which we take for granted, is something that people just lack access to those services. And so just that idea of information and knowing that X, Y, and Z exists is huge. And that's the impact that we're going for, is really being that trusted information source for individuals who are trying to access health services.
So these innovations have had a huge impact on the industry, in the healthcare industry. So I'm curious to see what, Marianne, you have to say about why it is super important for the private sector, but also governments to support these innovations.
Sure, no, thank you for the question. And I don't know how many of the viewers know, but the reason Merck for Mothers is focused on family planning is that if we address the unmet need for family planning in the world today, we'll actually reduce global maternal deaths by 30%. And Sid talked about lack of access. I think it's important to also recognize that sometimes lack of access is deliberate. And so whether we're talking about adolescents that don't have access to important information, and they're actively barred from getting that information on not only the fact that this exists, but the types of options that exist, whether it's cultural norms or religious norms that are doing this. And so that's why the power of technology is so powerful. It's disruptive. It breaks down those barriers to access. And I think it's just the collaboration that we're able to have with social entrepreneurs, with healthcare professionals, because at the end of the day, they also have barriers to access, as you were talking about. And they also need the tools and information and resources at their fingertips. And so, that's what we think that we can bring as a private sector partner, the ability to take risks on some of these things and invest in early stage development, but also to really think for the long term, how is it that they're going to reach the end user at the end of the day.
So I wanted to ask all of you about what are your future goals within your organizations and innovations, and how we can use those future goals to accomplish the Sustainable Development Goals.
We've shown that you can deliver higher quality care to more people by leveraging technology. And we feel that today there's no excuse to continue to do things the way they've always been done. Our goal is that people use whatever tools are available to them to deliver high quality care to every woman, every child, and every man also. Because to not do that, really there's no excuse anymore. So that's our vision, is that everyone everywhere is going to be delivering good care as they can by leveraging everything, technology included.
And I talked a little bit about adolescents, and it's something that I really feel strongly about, because we're not going to get to the SDGs unless we actually deliberately and thoughtfully think about how we're meeting the needs of adolescents. And I do think technology is a powerful tool for that. I know many adolescents that don't want to speak to people; they just want to text. And you said we don't have to do things the way we did them 20 years ago. I'm a physician. I'm used to talking, to patients. But if they rather not talk to me and tell me what their preferences are using technology, I should be able to respect that and respond to that and still serve them. So, we're not going to get to SDGs without actually listening to adolescents and responding to how it is that they want to receive these services.
Yeah, and I think these are all good points. That I think the idea here is that it's about access to information and trusted information. There's a lot of information out there, but not all of it's trusted information. And that's what Mark is doing with at the clinical level, is you know, we can only go so far. We're not clinicians. I'm not a clinician. I'm a technologist. None of my co-founders are clinicians. We're not going to build networks of clinics. We are going to enable people to access the right information at the right time whenever they see fit, and make the choices that they want to make. You know, I fundamentally believe that at the end of the day, everybody should be able to make the same choices that I've had in my life. You know, I've been able to do pretty much anything that I've wanted, and there should be no reason why anybody else should, you know, be deprived of that opportunity. And so I think, you know, for us, it's about getting people to trust the health system, so that when Mark, you know, takes over from there, you know, it becomes a trusted interaction that, you know, is really rich, because, you know, the client comes in informed, and I you know, it's a fundamental right, and it should be easy to deliver on given everything that we have today.
So what message would you like to convey to the general public, and also to innovators and people working in the private and government sector about how they should go forward to achieve these kinds of goals?
The message I'd like to promote is one of equality and of addressing inequality. And what I mean by that, and the reason, is that the world's poor are really truly poor. And they're really suffering as a result. They're dying unnecessarily. They're delivering at home. They're losing infants because there's not adequate drugs or care. And if we don't address that issue of inequality, we are, in my view, not really all doing our jobs. I think that as a civilization and as a country, it is our responsibility to share what we have with those that have less.
And I think, building off of that, I do think that, again, we're sitting in the innovation marketplace. We heard yesterday about a very simple innovation about using peanut butter to bring medicines to children. And so one of the things I think I would like to leave people with is sometimes the solutions, the innovations, are the simplest things, and they may even have us thinking back, you know, what happened, you know, before we had these, you know, technology. And so, you know, think about simple answers to the solutions. Really listen to those that you're trying to serve, because often what's going to make the difference are the simplest things.
Yeah, I think that's a really good point. And building on that, you know, having done many startups in my life and working with a lot of different people who are trying to start companies. So for the innovators, you know, it's really kind of simple, and I'm hijacking this from Nike, is just go do it. You know, just go out and do it. Just build that thing, build that first prototype. You know, you mentioned the Palm Pilot. You know, that was the first device that I programmed on. And
I used.
Yeah, exactly. And, you know, it was hard to program on, but, you know, you just build something and then you go. I think the other thing related to that is just go out and ask, you know, talk to people and say, hi, you know, I'm here doing X, Y, and Z, what are you doing? And, you know, not all those conversations will lead to something, but, you know, just by having that conversation, you know, sometimes that leads to something bigger. And so it's really just being open about what you're doing, and then actually just going out and doing it, you know, at the end of the day, because that's what we did with Livi, and I think that's what you've done, you know, all your life, and that's what, you know, Merck from Others supports, and you know, that's why we're here today.
Spread the word.
So thank you so much, Sid, Marianne, and Mark, for sharing your insight, your innovations, and your recommendations on how we as a society could work towards the UN SDGs.
Thank you so much.
Thanks.
Thank you for our viewers. Thank you.